Okay. I'd like to call this Personnel and Human Services Committee meeting of Tuesday, November 14th, 2023 at 4:03 p.m. to order. Roll call, please.
Nemeth,
Present.
Millet,
Here.
Benajak,
Present.
Herrick,
Here.
Radke,
Here.
Hoyer,
Present.
Begick.
Here.
Quorum present.
All right. Please rise for the Pledge of Allegiance. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
You said it the right way.
I'm going too.
Maybe I should cuss that. Jealous.
Is there a motion for approval of the Personnel and Human Services Committee meeting minutes for October the 10th, 2023?
So move.
Support. Any discussion? All those in favor?
Aye.
Opposed? Motion carried. At this time is public input. Anyone wishing to address the committee, please approach the podium. Please state your name and address, and please keep your comments to 5 minutes or less. Anyone? No. Okay. Moving on to petitions and communications. We would like to welcome Dr. Morrone to do a presentation. Thank you.
Thank you. I'm humbled to be here today. I hope to give you about 10 minutes of the data we have in America, in Michigan, and in Bay County. This is not my medical examiner report, but I will be back in the next few weeks to do a medical examiner report. This is abstracted and it uses a lot of other information. One of the things I consider to have as a blessing is I also am a medical examiner in Aranac, Iosco, Tuscola, and deputy in Midland. It gives me a greater perspective of all of our issues, and it gives me the opportunity to learn how to solve some problems. Currently, right now, I'm quiet, a little sleepy. Iosco, we have a murder. Somebody was killed in Detroit, and they dumped the body up there, and, you know, what do you do in the middle of the night when it's midnight and somebody finds a body in a river? And there's lots of stuff going on there. And I had the chance to do the Charity Island Aranac drowning, so that was interesting too. I'm the medical examiner, but I've also taught at CMU, and I was a liaison at the Department of Psychiatry. I've been a volunteer fireman in this county, and I'm a member at the American College of Osteopathic Family Physicians, so I have a general medical background, and my addiction clinic is how I feed my children, but I was lucky enough to study pathology at the Armed Forces Institute in Andover, Maryland, and I have a master's in toxicology, which is why I really like the drug use and treatment issue. I've also worked with the Saginaw Chippewa, the governor's Commission on Impaired Driving, and currently I represent my faculty interests at Johns Hopkins and SVSU School of Nursing. People rotate advanced practitioners through our clinic, and we train them. Mm-hmm. Some data you can't change, and it doesn't mean anything, and you just describe it. These are the death certificates we've had in the last 7 years, and we can see a little spike up during COVID. Mm-hmm. And death certificates are what I do. That's my job. That's the most important thing. I describe what happens to the health care in this county. It becomes death care. Nobody ever says that, but that's what it is. This is our cremation permits. And as of 2022, we're on a small hiatus, which is absolutely against the national trends. Everywhere in America, cremation permits are rising because funerals are so expensive. So I just described these. There may not be any reasons behind it, but what I do think is important is I look at data around us and say, what can I use and how do I interpret this? And I have to take a quick jump ahead to see what this is going to be. This is from the September 2023 Michigan Monthly Overdose Death Update, because opioid is synonymous with crisis and epidemic, and it's everywhere. So the data the state puts out comes timely every month, but I'm going to tell you that's garbage. And it's too hard to read. It's defined as overdose trends that may not be fatal, and fatal that may be provisional, and it's hospital, and sometimes it's EMS, and it doesn't take us someplace where we can make everything better. Now that was really important because I don't have a filter. I'm going to give you the truth. I'm not here to make friends. I'm here to make a better community. So now you know my style. This is the most important graph that goes back to what I just said. I had to search long and hard. When the state of Michigan gave us data, they'd give it to us 1 year at a time. This is 7 years of opioid overdose death data in the state of Michigan that I had to go to 3 different websites to put together because their statisticians can't give us a big picture. They give us a little picture and we're kind of chasing our tail like a dog or small dog. So from 2015 to 2021, my take-home point to you is in Michigan, we have no improvement. That's why there's opioid funds coming out and they're looking for ideas and financially how to support good ideas. My take-home point number 2 is, at best, when you look at this graph, there's no trend.
No.
What can you say? It's up, it's down, it's up. And at worst, it's a bad trend because in general, it just keeps going up, but it goes down, but it goes up, so you can't say anything. And what I'll tell you is, this data represents the integration of 2 administrations, one Republican and one Democrat, which shows us that we have failed policies by the people running things that they can't really improve on the last administration. Or it was so bad, it was hard to tell. Now, if we go 15 years back, you'll see that our overdose death rates are in the hundreds, not in the thousands, so things have gotten worse. But this data is important, and we'll come back to look at this later, because this is the reason why there's opioid funding. And for me to struggle for a couple hours to go to different websites to find a trend for 7 years. Now, the state of Michigan had fantastic reports 1 year at a time so that they could talk about the percent increase or decrease. But you need a big picture. That's why I have a master's in public health. This is the national data. This shows you that in America, opioids are increasing, fentanyl is increasing, and they've gone so far as to call it 4 waves of opioid overdose deaths. The first wave was prescriptions, which we struggled with for a little bit less than a decade. And then there was a short window of where prescriptions kind of went away, and then we struggled with heroin. And heroin wasn't around long enough that fentanyl became an adulterant in the heroin. It's not purchased as a medical product. It's purchased from drug dealers. And it has dominated the scene. So that's the first wave is prescription, the second wave is heroin, and the third and dominant wave is fentanyl. But we now, since 2019 and 2020, have what I will call the fourth wave, is the administration of a stimulant in the illegal fentanyl supply. And currently that's methamphetamine. And I think you can talk to anybody in law enforcement and they'll tell you how meth is just crazy. It's all over the place. It's either meth or it's fentanyl. This is a very specific Bay County graph. This is telephone intake for what primary drug you identify that you're suffering from that you want treatment with in our medication-assisted treatment facility that's rated as American Society of Addiction Medicine 1.0, ASAM 1.0. And this is the intakes as they have been abstracted by Saginaw Valley State University School of Social Work from our software from May 1st to November 7th, which is just last week. And what I want you to see is the people that are looking for help, the dominant drug is still alcohol. And the next drug, remember, this is what's coming out of their mouth. Whoops. I didn't touch anything. Oh. You know what? Let me go up here. There. Out of their mouth, they're asking for help with heroin. Heroin's been gone for 5 years. And they keep asking for it, and somebody sells them an unknown powder to snort, smoke, or inject, and they keep thinking it's heroin, but it's not. It's fentanyl, and then that's 22% of the people calling are asking for help, but heroin's gone. 24% are asking for help with fentanyl because they know what they're getting. So 28% ask for help for alcohol, 22% ask for the wrong drug because they're not getting heroin, it's gone. So fentanyl and heroin are kind of together. And then 13% of the people are calling and asking for help with methamphetamine. Methamphetamine on the street is probably a larger source than the people who are asking to get off of it, because people don't want to get off of it because you can stay up and clean your house in 6 hours that would have taken 5 days. Men use methamphetamine to hold down 2 8-hour full-time jobs. People use it instead of going to get an antidepressant from their primary care provider. We went from coffee to Mountain Dew to Red Bull to methamphetamine. The casuality of just taking another chemical. So, but here's what I wanted to say. More important, the takeaway message on this graph. Number one, there are no prescription drugs out there with the drug dealers anymore. That's gone. That was 10 years ago. Nobody is looking to get off of diverted prescription drugs. They're all looking to get off of alcohol and illegal drugs. So, we use a system called medication-assisted treatment. Medication-assisted treatment is a form of substitution. Every morning you take something, goes in your brain, occupies your brain, and tells you, I don't need fentanyl, I don't need heroin, I don't need what I ordinarily go out. And the way they work it is, these people get up at 4:30 and 5:30 in the morning to call a dealer to buy drugs so they can go on with the rest of their day. You come to our clinic, you get a prescription, you take your medicine as instructed, and you go to counseling, and you don't call the drug dealer anymore. Medication-assisted treatment is evidence-based. Anything out there doesn't have the evidence. We have the National Academy of Science, we have the American Medical Association, I have the Department of Defense, I have Harvard, I have Yale, I have Boston University, I have the University of Michigan. It's evidence-based. Everybody knows it works, and it's not always easy because you have to hold people to drug screening and counseling scheduling. But MAT, medication-assisted treatment, decreases opioid use, decreases opioid-related overdose deaths, and decreases criminal activity. We have the data to say that. Other people get up and say, well, you know, clinically our stuff is, no, it's evidence, it's statistical, it's published. And MAT allows people a greater social functioning to go back to work. Because you're either high with your drugs or you're in withdrawal with your drugs. And MAT lasts longer and it's lower dose and it's controlled. We also see that MAT improves outcomes for babies with pregnant mothers. Counseling is mandatory. This graph in the blue box shows us that the studies shift the data to positive numbers when it's MAT and counseling. In pharmacology alone, they just don't improve as much. And the most important thing as a provider is this is a DEA slide. The drug enforcement tells me that buprenorphine, the drug we're using, works best when it's with psychotherapy. So I showed you the problem in Michigan, I showed you the problem in America, and now I showed you this is MAT. This is kind of what happens. This is a study done in Europe that went over a year. And the 75% blue or green box buprenorphine shows that when you take your medicine, you stay in counseling. The red circle and the black dots straight down show you that if you don't take the medicine and you just say you're going to go to counseling, you have 100% failure and relapse in 60 days. MAT keeps you in counseling. Counseling changes your behavior. So MAT shows how to save lives and keep people in counseling. This is European data. This is American data, which shows us that the abstinence-based counseling still separates from the buprenorphine treatment. And in this, the original group was buprenorphine counseling, and it was randomized and split, and half of them in the red box had their buprenorphine taken away from them. They were tapered to 0. And you can see the precipitous decline in treatment attention, the retention. They're not going to therapy anymore, and if you don't go to therapy, you don't make changes. This is Bay County overdose death data to position with American and with Michigan data. This is 12 years of data. And you can see that there was 1 year in the middle where overdoses went down. That was the introduction of Narcan. Bay County was the only county in 83 counties to drop in Narcan. That year, I went out to about 100 different police agencies and EMS, and we injected oranges, and we blew spray up styrofoam models, and we really worked it. But the next year, the green bar, which was 2017, was the full introduction of fentanyl into our pipeline. Fentanyl just exponentially shot up, and overdoses went out of control. But we grew, and we were happy. As an advocate for treatment, I can tell you it wasn't easy because the reimbursement is really not as good as some of other areas of medicine. But we grew, and slowly, you can see there is a decrease from 2018 to 19 to 20 to 21. And just this last year, which will be in the next annual report, we have a 30% decrease in opioid overdose deaths in 2022. That is 1,000 buprenorphine injections and 3,000 Narcan kits given out. I'm going to take a lot of credit for this. McLaren didn't do this. Bay ABH didn't do this. List didn't do this, and Sacred Heart didn't do this. We gave 1,000 injections, and now we moved from Essexville to the 1,000 block on Washington. I expect us to grow and give more injections. The biggest difference between buprenorphine for the last 10 years and the injections are that you can't decide to not take your medicine every morning. It's in your fat, it's subcutaneous. And somebody might say, well, you can't say that's all you. Joel Strauss would say that. He's my boss as medical examiner. And I'll say, that's 1,000 injections in this county. And nobody did 1,000 injections. So that's the good news for Bay County. But it has to be sustainable. And there's no other county in 2022 that reduced deaths by 30%. And we can hold on to this by continuing this therapy. These are the drugs that kill people from our tox. You'll see these again in the annual report in 2 or 3 weeks. Total drug overdoses were 29. It was 41 the year before. And the number one drug that is our demon, that is our devil, is fentanyl. You can see it all across America. And methamphetamine, cocaine. That quetiapine is a suicide. But here's the other thing I want to say. Look, tramadol and hydrocodone are 0-0. They're on the far left side. And I showed you on my other graph that prescriptions are no longer the issue. It's 100% illegal drugs, diverted drugs. So let's go on to my claim about how criminal justice can benefit, because just stopping people from dying does not bring a higher quality of life. Changing lives through therapy is important. This is a study done with buprenorphine that compared Franklin County to Hampshire County in Massachusetts. And you can see that the county that did not use medication-assisted treatment had 63% recidivism on the people that left jail. They got rearrested. And you could talk to anybody who works at jail, and they'll tell you half of everybody comes back. They're always regulars. They're the same faces. Sometimes it's the same generations. It's fathers and sons. That is recidivism. What is important is that sometimes people get arrested for new criminal charges. And buprenorphine MAT therapy started in jail and continued into the community reduces recidivism of the same crimes and new crimes compared to an abstinence-based program. But the one thing that I am more impressed with is there are 32% less probation violations, which means people's jobs are easier, not just the road patrol, but some of the civilians working in criminal justice, that you have a better population. So I showed this graph to my friend Sherry Lindsay, who runs Saginaw County Community Mental Health Authority, and I said, I'd like to talk to your drug courts because we're already working in our drug court here in Bay County. And she said, well, I'm glad you brought me something like this, because if you just brought me overdose death data, nobody cares. They want to see less people get arrested. So I got a meeting with Judge Borrello, and I got a meeting with Under Sheriff Miguel Gomez, starting to talk to them to see if we can help them out. This is Massachusetts. The important thing is I have data that shows since we brought medication-assisted treatment to the drug court, more people are graduating, less people are falling out, and less people are getting rearrested. I can put that in my other report. But I want to finish by telling you that our opioid legislative settlement core abatement strategies from Health and Human Services in Washington ask for us to consider these 9 major issues. Number 1 is Narcan distribution, and Narcan is considered the first MAT because it reverses the opioid overdose death. Number 2 is a general increase in treatment of all people with MAT, not abstinence-based counseling. Number 3, MAT treatment in pregnancy so that we can have drug-free mothers giving birth. Number 4, reducing the neonatal abstinence syndrome that comes from the number of mothers that have a substance use disorder. And number 5, MAT in incarcerated populations. Number 6, a transfer from somebody like me with an addiction clinic to a non-addiction source like BABH, and that we share, a warm handoff, that we share people. Number 7 is prevention. And number 8, they want us to consider syringe exchange programs, which has to be debated on its own. And 9, to measure these changes to see that they actually have a lasting impact. So, from Washington, D.C., from SAMHSA, from Health and Human Services, I will show you that of these 9 core abatement strategies, 6 of them include MAT. That should be the focus of how we reduced deaths, and as we go forward and there's judgments and other considerations for how we support things in the future, MAT matters. MAT is evidence-based, and anything else is kind of just an idea that hasn't been proven. So, I'll take questions, and I really like arguments. Vaughn.
Yeah, so I guess you're not real fond of the Michigan Opioid Commission, the state entity.
I'm going to be real honest.
No.
It's a public health medical problem, and a judge is in charge. Are the lawyers here? Are they lawyers here?
Right here. Got a couple.
I would never go to Begick's nursery and ask for help with my divorce or financial planning. I know Linda Davis. I've been to dinner with Linda Davis. She's not the right person to guide opioid strategy in this state. So, that's my answer.
Yeah, we're working with MAC, Amy Delinky is at the Michigan Association of Counties, and they're doing a lot of.
Here's the difference between the commission and MAC. MAC is ground roots, grassroots, up. The commission is people down. And it's no disclaimer against Gretchen Whitmer. I voted for Gretchen Whitmer, but every administration uses that commission to reward political donors. It's every single, from Whitmer, Snyder, Granholm, it's a dog show. It's fluff. And if you go back and look at some of the data that I did for overdose, and you go back to like 14, 15, 16, and you see some of the recommendations, those recommendations made the state worse. And they all come from people that don't treat. There's nobody in that commission that has a big practice that treats. There's a lot of sheriffs, lawyers, judges, and human service people. But MAT is what matters. And that's the biggest difference to the commission. Yeah. That commission's abstinence-based.
Yeah. One last quick one.
Yeah.
So providers of the service is a big obstacle. We've been working for quite a while for the PAs to get PAs and MPs to get a little more reimbursement for what they do. That's been a problem. Legislation hasn't passed it yet. We could get more providers out that way because there aren't enough providers, mental health and whatever else. So.
Somewhere in Lansing, somebody wants to just keep things the same because the changes you're asking for mean rewriting laws and having meetings, and they're not real keen on a lot of big changes. That's why the things that come out of the Opioid Commission are suggestions or guidelines. They rarely get to laws, but the one law that really set me off, and I went to Channel 5 and I told them, this is wrong, more people are gonna die, this is crazy. And then I went back in 2018 and I said, look, deaths are up because you did all the wrong things. They put all these tight rules on prescribing opioids
Yeah.
without any increase in the budget for treatment. That law drove people to heroin. And that you can see it in the graph. When that law hit, overdoses went up. You literally took away, as long as you had people misusing opioids through a doctor, the better money spent would have been to train providers to bring people into treatment instead of cutting them off. And I see people every day. We have 12,000 visits at Recovery Pathways in a year, and I hear those stories about people being cut off. Well, they broke their back or they broke their jaw. There's all sorts of medical problems that led people into going away from opioids to heroin because the doctors cut them off, because the doctors were afraid. So,
Yes, been there.
anyway.
Just a couple of comments and
Yeah.
one question, Dr. Morrone. Thank you for your success in saving Bay County residents' lives with your treatment program and the region, not just Bay County. We appreciate what you've done.
Thank you.
And I agree with you that you have to combine psychotherapy with the medications. And if you look at the track record, you're right on target. What do you think we can do to sort of reach out through a public education program to try to convince people that they aren't taking heroin, they're taking fentanyl-based substances? And I mean, I think if we could educate the public to the standpoint that they know that they are literally risking their lives by ingesting some of these substances, and I know we have
no idea
mental
how
illness.
dangerous it is, really. You're right.
And I know that when we look back at the DARE program, and I used to participate when I was a legislator in a lot of those programs for fifth graders, seemed like there was, mixed results on whether it was targeted toward a younger, population in the fifth grade as attributable to its sort of lack of success. But what would you suggest in trying to reach out to the public to let them know? Every time you take this substance, if you get just a few grains of extra fentanyl in that mixture of that substance you're ingesting, either injecting, snorting, or otherwise, do you have any suggestions on how to curtail the demand for people? It started with oxycodone and the opioid over-prescribed, even here in Bay County. I think when we litigated Bay County under the RICO statute here in Michigan in the federal court in Columbus, Ohio, I know that our data showed that in Bay County there were enough prescriptions written to provide about 30 pills a day for every man, woman, and child residing in Bay County. And that is obviously way too many prescriptions. And I think you're very accurate. Because of the focus now, the medical care providers have really, and doctors have really curtailed their over-prescribing of opioids. But now we've got this other issue. It's gravitated to heroin and to other cocaine, probably. Well,
I don't
what do you think we
believe-
can do to educate the public?
I don't believe in reinventing the wheel. There's no new idea. We have to go back to public health, and if we were going to tell people they needed to do 6 feet, masks, and immunizations, and we ran it through the health department and the hospital, we need to take that message about rethink your alcohol, rethink your heroin, rethink your fentanyl, and it has to go to every PA, family nurse practitioner, and clinic that has a license in this county, because they're looking at people that are using drugs, but they're not drug testing them, and they don't know who they are. But that message has to go there, because in Canada, they had a campaign that showed, because it hit me really warm, it's kind of strange and dark. They showed a dead body with a toe tag under a sheet, and it said, fentanyl kills, and fentanyl is everywhere. I thought that was brilliant because it was so simple. Don't reinvent the wheel, steal something from another country or from another county or from another state. It's, if we were willing to do all that for COVID, what we have now is a different population. These are factory workers, these are mothers, these are fathers, these are children, these are teenagers that are dying because of the fentanyl. We need to go back. The My Michigan site on the west side, McLaren and its different campuses, the residency program, it's too much of an invasion in privacy to drug screen everybody, but you can put the placards out. You can put out questionnaires, and you can put out posters, and you can put stuff on buses and drive it around. That it's not just, you know, the addiction messages that we have now are prevention. They're really nice, but they're kind of soft. You have to tell people they're going to die. A funny story, I went to Midland. There's a legacy center. They put out a magazine. I bought a full-page ad. I said, heroin and fentanyl kills. Call me. I'm Dr. Morrone. I'm the #1 prescriber of buprenorphine in Midland County. And I think I put a picture of somebody dead on there. They gave me my money back. That's what you need to say. How else are you going to say it? I mean, I think we're a little soft on that, but that's what we need to say. In every clinic, every family practice, every pediatrics, every internal medicine, and at the hospital, and in ER, that we need to warn people about fentanyl, because I see some things happen in ER that is not testing for fentanyl. And then people are treated, somebody wants to try to help somebody, so an ER doctor gives somebody Suboxone, and they have fentanyl, but they don't test it, they throw them into precipitated withdrawal. That same thing happens at Covenant that's not testing for fentanyl. So two points. Warn everybody with public warnings about fentanyl, and maybe the health department should mandate that people start testing for fentanyl. So this county is not behind. We're keeping pace, but there are certain projects that health department do better, McLaren could do better, but we're not behind compared to where some other people are. I just think we need to be more sustainable. And that message about fentanyl, the warning in the clinics, with the doctors, with the nurses, with the ER, that message has to go out. We talk about that next month when I do the report. Thank you.
Thank you.
Thank you.
Thank you.
All right.
Thank you.
Thank you, Dr. Morrone, for that informative presentation. Thank you so very much.
I guess move to receive.
I'll support that.
Yeah.
Is there any discussion? Okay, all those in favor?
Aye.
Opposed? Motion carried. Board Chair Begick, regarding the opioid settlement task force subcommittee, settlement funds, motion to adopt.
I'll move that resolution.
Support.
Any discussion?
Yes, so talking about opioid settlement funds. So we have to have a motion. There's a 15% withhold we can do for recovery for previous costs incurred related to opioid damages. And it has to be done on an annual basis. So the resolution is in front of you. And that is my motion, that we withhold that 15%.
You moved it?
Who supported it?
Did you move it?
I moved it, yes.
Support?
Oh,
Yeah.
yes,
Yes,
yes.
and I don't know if it was intentionally left out of the resolution or not, Commissioner Begick, and if
Yeah.
it was, that's fine, but there was also another recommendation in the memorandum that was submitted for 15% of the 85% to be used for reimbursement purposes for the prior year's spending. Did you intend to include that or to leave it
I
out?
noticed that after it came by, yes, I would amend the motion to include that 15%, So there's 15%
Administrative.
off the top, then there's 15% of the 85% that we have to, and that,
Okay, we have the
Yeah.
amended
yes.
resolution. Okay, a motion to adopt.
He made it. I supported
Okay.
it.
All those in favor? Aye. Opposed? Motion carried. Building and Grounds Superintendent, motion to adopt county building basement repairs.
So moved.
Support?
Any discussion?
No, Kristen, do you want to explain what this is all about?
I
Or
could,
John.
but I know John would probably
John,
love
okay, John.
to do that for you.
Thank you.
You're welcome.
Yes. Was there a question?
Yes, you want to explain to the board what this is all about?
Our basement, part of our basement is underneath the back parking lot. I don't know if everybody knows that or not, but of course, we try to keep the water out as best we can. We've had some water entering in. We had a gas main that used to come in underground in the parking lot that has since been replaced with consumers. They brought it in the north end of the building, above ground. So that's no longer an issue down below. But we've got some beams, we've got the decking with spalling concrete, and there's rebar showing. It's been this kind of despair for a handful of years. A couple years ago, I've had an inspection done by Spicers. They did not really build a scope how to address the different areas and the issues. So I needed more of a targeted, direct approach to it, and so that's where I need additional engineering for them to come in and tell me what to do with this beam, so I can go out for bids with the same project in mind for all vendors that would be participating. And for that cost, I needed the additional funds that I pulled out of my current budget.
So this resolution is asking just to sign the agreement with Spicer, but the funds would come out of our 2023 budget.
Thank you, John.
You're welcome.
For the explanation.
Yes, thank you. Okay, all those in favor? Aye. Opposed? Motion carries. Director of Recreation and Facilities, golf course utility cart, motion to adopt.
Support.
Any discussion? Yes.
Thank you. Kristen, I just want to say that, anything that the golf course needs, I'm totally in favor of, because I know where we were with the golf course, 7, 8, 10 years ago, and it's come a long way, and every person who uses it, that golf course, loves that golf course. They say it's one of the best in Bay County, if not the best. It's always in great shape. The people out there do a lot with a little, and so this is something, like any equipment, I think is important out there at this point, because if you don't keep it up, then they don't like it anymore, and then your rounds go down, then you don't have any money. But, I know it's making money, because for a long time, we were supporting the golf course just to keep it open, but we've turned that corner, and now we just got to keep it going, I think. But great job, especially anybody who works there. You run it, but you're the top person, but there's a lot of other people that do that work out there too. We don't cut the grass, but the people who do need all the equipment they can get. So thank you.
Thank you. Yes. All those in favor?
Aye.
Opposed? Motion carries. Motion to adopt the Department on Aging support staff position.
I'll move. Support.
Okay. Any discussion? All those in favor?
Aye.
Opposed? Motion carried. Office of Assigned Counsel, the September 2023 report.
So moved.
Motion to receive.
Support.
Any discussion? All those in favor?
Aye.
Opposed? Motion carried. Are there any referrals? Any unfinished business? Any new business? Amber, is there a need for closed session?
There's not, Madam Chair.
Any miscellaneous? Any announcements?
Just want to say the vets event last Thursday was real good. I went by there and found some stuff I could use. So thanks for Matt and Mark for putting that on.
Yeah, I'd like to echo that. Thank you, Matt. Great job. We had over 20 vendors there, and the vets who came through the program that day, I think, were very appreciative, and we had a number of elected officials who shared their insight on our appreciation for what veterans mean to Bay County, to Michigan, and to our nation. So thanks, Matt. Great job.
Thanks. And for the Mark and Gary, I want to also thank without them, we wouldn't ever be able to do it. So my team.
Thank you.
And the ceremony at our county building on 11/11, that was excellent, and Shauna brought her son, and it was nice to see, some younger people. Yes.
Oh, one more thing, that tomorrow's the opening of firearms deer season, and I'm sure all of us want to wish everybody good luck at, who's going to go out there and try to get the big buck like they always do every year, and
Yes.
90% of them come home with nothing, but that's okay, everybody has a good time. And we know all the northern schools for Pink County North, they have the day off, all the students have the day off, so it'll be a little crazy out there. So they finally, it took them a long time to realize that, but give them the day off because they weren't going to come to school anyways. So,
I know.
but good luck, all hunters.
Motion to adjourn?
Support. Any discussion? No. Okay, all those in favor?
Aye.
Opposed? This meeting is adjourned. Thank you.